Finally. All right. It's working. Woohoo! Hello, 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 my friends. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. We have been having technical difficulties, and it's very cloudy out there, and now everything is all messed up. So, anyway, my purpose in support group meetings is to make you so strong, so knowledgeable, so informed that no one can ever mess with you, especially on Mother's Day. Because you can't find a better mother than a mom with IC who is giving her all to care for her children, even when she's got pelvic pain. Hello, Hendria. It's nice to see you. Hello, Sue. It's nice to see you too. Let's see here. Success! So I've been trying to set up this support stream for 30 minutes. And unfortunately, Facebook changed the settings yet again and forced me to download software, which meant I had to shut down the YouTube stream and restart everything again after downloading a massive software update. So I apologize profusely for this late delay. Deep breath. Hello. Hey, Karine from Belgium. It's nice to see you. Hello, Julianne. Hello, Heather. Very, very nice to see you guys. I don't know about you, but I had a nice breakfast with my mom this morning, and it was wonderful. Here, give me one quick sec. I've got to go get a drink of water. I will be right back. Give me one quick moment. All right. Okay. What a day. So let's see. Got to sleep at 3 in the morning. Got up early. Had to prepare everything for my mom. She's 91 years old. And we had a wonderful brunch. And I hope that you guys were able to spend a little bit of time with your moms because they are such blessings to our lives. My mother, Helen Osborne, is in fact the mother of the IC Network. I will tell you, I would not be here today if it had not been for her. That when my IC started, she picked up the pieces. She drove me to the doctors when I couldn't sit in a car. She sat with me at the emergency room when I was at the emergency room. You can't have anybody better than my mom when you're at the emergency room, right? She will sit there with this pleasant look on her face, exuding strength and confidence, and will be there through thick and thin, through the hardest moments of your life. And so to every single mother out there, I truly wish you a wonderful Mother's Day. However, I gotta say, I started the day reading an essay about motherhood on, I think it was Vanity Fair. I will try to post a link to it. And it was about a daughter explaining what life was like having a mother who had polio as a child, and how that mother was struggling in many, many different ways. That she was struggling to express love. She was filled with a lot of distrust about her life. And ultimately what it came down to is that as a child, she had been in a polio center for a month and had basically had no contact with her family. And it really, really messed her up. And it really made me think. It made me think a lot about the way that IC affects our ability to be moms and our ability to be daughters. And that here you are doing your best to get through the day. And most of you are hiding your pain. Most of you have not told your family that you are in the pain that you are in. You're trying to be normal. You're trying to be functional. And yet there is a big giant fight going on inside your body. And when night falls and everybody's asleep, that's when we let it out, right? That is when we let it out. And if I can give you one message here, one message about being an IC patient and being a mom, is that IC does not change the love that you have in your heart. IC does not change your ability to be the most important part of being a mom, which is giving hugs, giving love, being there, giving pep talks, giving comfort, making food. And I don't want you to let IC change that. I don't want you to let IC think that you are a lesser mom than you are, because it's simply not true. In fact, I'm going to argue, I think that you're probably a better mom now, because you know what it's like to be alone and suffering. And you would never wish that on your children. And as a result, you are going to be there through thick and thin as much as you possibly can. And so to my mother, Helen Osborne, who, after she had decided she was never going to drive on freeways, drove me from Lake Tahoe back to Santa Rosa, a 3.5-hour drive, while I was crying in the back seat because my pain was so bad, pulling over so I could pee in a snowbank because I had a flare, to those really funny moments, like looking, I mean, if there's one thing we IC patients know, it's every freaking bathroom in our community, right? We do. We know every bathroom in our community. But having those funny moments when you're actually looking for a bathroom, it's like, I really need one now, and I'm telling you, moms can pull it out of their hat. They know where to find them. They know where to pull over at a local park, whatever. But I think that having IC and being a mom is actually makes you more compassionate. It makes you more determined. You have never been more prepared to deal with whatever happens to you than you are at this very moment, because you are truly one day older and one day wiser. You're not going to repeat the mistakes of the past. You've learned from the mistakes from the past, right? Here, hold on. We're still, you guys, for those of you who came in, we were having technical issues here. Yeah, I'm just going to get rid of that light. So I truly hope for the moms out there that you're having a great day and that you know how much you're loved. Hello, Teresa. Teresa, I've never been to one of these. I have an interstim to help with my IC. It still hurts when I pee. Thank goodness for Azo. Hi, Teresa, welcome. Jennifer says, can you talk about hormone replacement? Absolutely. I would be more than happy to talk about hormone replacement and pudendal nerve entrapment. I can definitely do that. Hi, Tabitha. Yes, that's true. I know where every bathroom in my area is. Yeah, we do, right? I mean, like, seriously, we know all of them. Like, we almost know every bush, too. Right? Okay, now I'm wearing this floppy top, and it's making me crazy. All right. Okay. So let me introduce myself for people who are new. My name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I'm the longest serving IC support group leader in the United States, and very close to being the longest serving support group leader in the world, to be quite honest. I think that the German IC group is, if they're still having meetings, they would be older than the IC network, because I know the ICA hasn't done meetings for years. So it is my privilege and honor to be here for you and to take any questions that you might have on IC. The way I do these meetings is I'm pretty much doing them every Sunday now, with a through sprinkled in throughout the week. I start with a 30-minute educational something, a little lecture on something that I think is meaningful and important. Then I usually do about 2 hours of questions, depending upon how many, if y'all are here and they have questions, I'm happy to take them. And then usually we do a giveaway at the end of the meetings. Don't have a lecture for today. I just don't. It's been a busy week. It's been a crazy, crazy week here. Just dealing with COVID and dealing with our store. I mean, we're very lucky that the IC network is a business. We can stay operational right now. Everybody is working from home. We have updated our store for people who are looking for chair cushions and heating pads and supplements and things like that. You can go on over to icnetwork.org and click on shop, and you can see products that I have personally curated for you. We have been doing this for a long time. I've had a store now for at least 15 years. And my job is try to give you options. I want you to have as many possible options as you can as you are contemplating therapies. Now, guys, the one thing I really need you to understand is that we no longer think of IC as an incurable bladder disease. We don't. We think of IC instead of pelvic pain syndrome. Why? Because we know that structures outside of the bladder are also involved. And so now when you go to the doctor and you're having your diagnosis for IC, what we're doing is we are doing a much more expansive diagnostic workup to try to understand what structures, if any, could be contributing to your pain. So we now know that some of you have Hunner's lesions, which we now believe are viral infections of the bladder. That is one theory that has been supported by research from Europe. We know that some of you legitimately have gone through chemotherapy, if you've had some sort of chemical trauma, if you've used ketamine, if you drank diet soda for years and years and years and didn't drink water, things like that. We know that the bladder wall and the bladder itself can be damaged by prolonged exposure to harsh chemicals and acid. But we also know that the bladder wall can be affected by menopause. And so if you're starting to be of a certain age, like I am, where your skin is starting to get a little bit drier, believe it or not, your bladder will also show the loss of protection on the gag layer, that very thick, robust mucosal layer in your bladder wall that normally protects your tissue. And it's normally really thick. Of course, when you're young and you have lots of estrogen, you've got a really thick, robust bladder wall that can protect you. When you're older and you have less estrogen, guess what? You have less mucus. So your bladder wall is going to be more vulnerable. That is why many women start to experience the symptoms of IC after having a hysterectomy. If they're younger, they're having some sort of hormonal issue, or if you're starting to be in your 40s, perimenopause. Guess what, guys? That's when it starts. That's when you're going to start seeing some of those symptoms. And we also know that some patients can have chronic infections in their bladder wall. They could have a chronic bacterial infection in their bladder wall, or they can have a chronic fungal infection. And that reminds me, I had a really, really, really interesting patient that I talked with, I think on Thursday. And what made her so unique is that she flared when she ate carbs or sugar. Those were her worst triggers, is when she ate carbs or sugar. Now, normally, if you had a typical like chemotherapy-induced bladder wall injury, carbs and sugar are fine. It's the acids that are going to irritate that bladder wall. So why would somebody flare after eating sugar or carbs? The answer is because they have a fungal infection. They probably have a candida infection. And for a case, 100%. There's no doubt about it in my mind that this woman has a very robust, aggressive candida infection in her bladder that is triggering her IC symptoms. And she had been on antibiotics for an extended period of time. Her symptoms started using the antibiotics, et cetera, et cetera, et cetera. Okay? So don't underestimate candida. Now, of course, the challenge here is when you go to the doctor and you've got all the symptoms of frequency, urgency, pressure, pain, and you go, hey, doc, I got an infection, and they do a urine test. Guess what? That typical urinalysis does not test for fungus. It does not test for candida. And so you might be completely negative with your urinalysis, and the doctor goes, I don't know what the hell you have. The problem is that they haven't done the right test. You can have a next generation urine test, and that will identify if you have fungal infection. And that is really, really important now, because we have 3 or 4 studies from our own National Institutes of Health that has undeniably proven that many patients having flares are having flares because they have a fungal overgrowth in their bladder. And the most recent one was earlier this year, and I highlighted it in our last magazine. And so if you're one of those people where you're flaring when you're eating carbs or you're eating sugar, you have to suspect. You absolutely have to suspect a candida infection or a fungal infection. Now, we have another subgroup, and that subgroup is patients who have extremely tight pelvic floor muscles, injured pelvic floor muscles, et cetera, et cetera. And I was talking to my family, I was talking to my best friend last night about it. And the thing that really surprises me is the number of patients who have tailbone injuries. If you have fallen and broken your tailbone, you have to understand that you have also injured your pelvic floor muscles, and God forbid your tailbone now be out of position. Normally your tailbone has a nice curve in it, right? It kind of curves this way. If you've broken your tailbone, it might be straight, or it might be bent the other way instead of this way, or it might be to the left, or it might be to the right. And that is always going to put a terrible strain on your pelvic floor. And so now the number of patient stories we're getting is absolutely fascinating to me, that when they finally figure out their tailbone is out of position and they get that corrected, either with pelvic floor physical therapy and or chiropractic, their symptoms improve dramatically. So as we think about these subtypes and variants in the IC patient community, understand that the pelvic floor subtype really is the Oh, Suzanne, great. Suzanne said, my urologist diagnosed me with cystoscopy. After the exam, she sat me down and said, so what would you like to do? And she said, what the hell? I don't know. And then Suzanne said, thank you, Jill, for educating me. Awesome. Good, good, good. Happy to do it. The next group that we look at, so we've got bladder wall injury, we've got pelvic floor injury. We have to look at nerve injuries, because nerve injuries also happen in this community. So if you've got shooting pain down your leg, like sciatica, if your pain is electrical, it's a searing pain. If you feel a fluttering, like you're sitting on a cell phone on vibrate, or if you have persistent genital arousal disorder where you're dealing with this really weird, awkward, uncomfortable, creepy, I'm kind of aroused, but it hurts really bad, that all points to the pudendal nerve being injured. And so if you're somebody who every time you sit down, it hurts, and when you stand up, you're better, you have a pudendal nerve injury. We also want to look at the skin, because the skin sometimes gives the clues as to what the health of the nervous system is. So if the skin above the area is reddened, if it is prickly, if it has numb areas, that strongly suggests that there's an issue with the nerves underneath that. Or if when you do this, so if you do this over your bladder, right, and you feel tenderness, not deep where your bladder is, but in the subcutaneous tissue, like, here, hold on, let's see. Okay, I had to make sure my zipper was up. Okay, so if you do this on your little belly and you notice pain just right in that subcutaneous area, right underneath the skin, that also helps us understand that you could have a nerve injury. Now, the last subtype is central sensitization. That is the subtype that is often inherited. This is my dominant subtype. Hello, redhead from Norway, characterized by the world's most sensitive skin. Like, I tried to wear something else today and I couldn't do it. I have to wear soft clothes, especially on my arms. My arms are insanely, freakily sensitive. We tend to have a sensitive stomach. We tend to have a sensitive gut. We tend to have a sensitive bowel. We tend to have, a wicked sense of smell, that we can smell things. So my niece brought some flower arrangements yesterday, wearing her mask, of course, for my mother. And as the evening was going on, it was like, okay, I'm really smelling them. By the time I needed to go to bed, it was like, oh my God, I'm having allergies, and I had to put them outside. Another sign of somebody with a really sensitive nervous system or central sensitization is chemical sensitivity. where if somebody's wearing a weird perfume, or you walk by somebody who's smoking, or if there's a bad bathroom odor, or if there's wood, somebody's had to finish wood, a strong chemical in your home, or oven cleaner in your home. If you're one of those people where you have to run out of your house because that smell hurts you, that means really that you have central sensitization. And central sensitization is often the luck of our ancestry, because everybody in my family is sensitive. There's no doubt about that. I mean, it's passed down. But sometimes sensitization also happens after you're injured. If you suffer a major catastrophic injury, the nerves in the area will become more sensitive. And sometimes that sensitivity can spread to the spinal cord and to different parts of the body. We don't look at sensitivity as a disease. It's not a disease. It's the gift of my ancestry. And it's my job to respect that sensitivity. It is not my job to push it. I would be stupid if I continued to push things that I know bother me and irritate me, which is why you're never going to see me do caffeine, because it provokes me. I'm going to do decaf coffee if I'm ever going to do coffee. So at least for my subtype, my bladder is perfectly healthy. There's nothing wrong with my bladder, except when you put fluid in it. If you put 100 to 200 cc's of urine in my bladder, I feel it. Somebody without central sensitization, you could put 1,000 cc's of fluid in their bladder and they don't have to do anything. Whereas for me, I absolutely feel it. So anyway, there you go. So we've got this tremendous diversity in this patient population, which is helping us find the best treatments now. We can cure people now with this subtyping system. Some of these subtypes are curable. So anybody who says this is an incurable bladder disease, they're not reading the research, they're not reading the subtyping systems, and they're not listening to those top international doctors who are saying, please stop depressing people and telling them that there's no hope, because there is hope. There is absolutely hope now. But if you go to a doctor that hasn't taken a class in IC, hasn't attended any of the latest urology conferences, which of course are all now canceled, which is, it is what it is. If they're teaching IC out of a textbook, if they say that Elmeron is the only treatment, you got somebody who just simply isn't informed. And so you and I get to be the educators here. You and I get to bring them resources. I believe in bribes in the funniest of ways. Whenever I personally work with a doctor, I bring them gifts, and usually my gifts are going to be a book or something like that has information in it that I think will help them, because I understand that they don't have the time to be up to date on every condition that they treat. They just don't. It's only a small number of clinicians who are so passionate about IC that they read everything. And so my job here is to try to give you those resources so that you can kind of stir the pot and you can encourage them to look beyond their specific box, if that makes sense. All right, so let's see here. It's a miracle. Facebook actually allowed me to scroll back in the comments. Woo! Let's see here. So again, going back to Teresa said, I have an interstim to help with my IC. It still hurts when I pee. Thank goodness for Azo. So Teresa, if you're still here, and I can see that Facebook people are going in and out of the meeting. So Teresa, I want you to think about when it hurts the most, because you said it still hurts when I pee. Does it hurt before you pee as your bladder's getting full? Does it hurt while you're peeing? Or does it hurt after you're done peeing? When it hurts is critical here, because that will help us try to understand what's driving your pain. So if you have pain as your bladder is filling with urine that is relieved immediately after you pee, even just for 5 minutes, but if you feel better after you pee, that tells us your bladder wall is involved. If you have pain while you're peeing, at the moment that you're peeing, It can be I mean, it can be several things, but that helps us focus on the urethra. Generally, icy flares usually don't cause pain while you're peeing. The exception to that is going to be somebody with estrogen atrophy, or it's going to be somebody with an infection, or if you've got chemical sensitivity, it could even be a reaction to soaps and things like that. If you have pain after you're done peeing, pain as urine is crossing your vulva, that points to estrogen atrophy and the quality and health of your skin, as well as perhaps vulvodynia. So if you're still here, Teresa, let us know, when is your pain the worst? Before you pee, while you're peeing, or after you're done peeing? Jennifer says, can you talk about hormone replacement? Sure. Let me get a little slide here. All right. So this is a three-dimensional picture of your bladder wall. So remember, when I was growing up, I never thought I'd be talking about the bladder. It's strange, but you know what? I'm really fascinated by the bladder now. The bladder is the only organ in the human body designed to hold toxic waste, because urine is body waste. Urine contains ammonia and urea and all sorts of weird things. So how can the bladder hold ammonia for hours at a time and not get damaged? And the answer is that your bladder is like your mouth. It is a hollow organ covered with a really thick, robust coating of mucus. And it is that nice, thick mucosal layer that acts to separate the chemicals in your urine from your skin, right? And so let's look at this picture. So this blue area is, in fact, your protective layer, your mucosal layer, or your gag layer. And then underneath that, we've got 4 to 5 layers of urothelial cells. These are the actual cells of your bladder wall. These are the largest single cells in the human body. Imagine an extra large pizza, and then imagine a little tiny pea. The extra large pizza is the equivalent of one of these cells. And when it is damaged or destroyed, there's a little tiny stem cell underneath it that starts at the bottom that will eventually fill into that spot. But it takes a minimum of 2 weeks. So if you're expecting your bladder to heal overnight, you are not understanding your anatomy, because the bladder is the slowest healing organ in the body. You got to stick with it for a while to give your bladder an opportunity to heal. And then underneath that, underneath this urothelial cells, we've got blood vessels and nerves. So why do hormones matter? Because this blue layer, of course, it's not blue in your body. It really is clear. It's like your mouth. But this blue layer on this diagram is that mucosal barrier, and it is estrogen dependent. So when you're young and you've got lots of estrogen, you've got lots and lots of mucus. When you're older, you've got much less estrogen. Okay, see, there's the full, and here's the less. You've got much less estrogen. That means that your bladder wall is thinner. That means the irritants in your urine is going to get closer down to the skin, damaging the skin and potentially triggering these nerves here. So from the bladder standpoint, there's something called the Genitourinary Syndrome of Menopause. And the Genitourinary Syndrome of Menopause is basically what happens to your urinary tract when you start to lose estrogen. You get frequency, urgency, pressure, pain. So how do we treat that? We treat that with a topical hormone cream. It's not normally treated with an oral estrogen. It's normally treated with a topical estrogen for a couple of reasons. Number one, when you take an oral estrogen, it's distributed throughout your body. It can go to your breasts. It can go everywhere. And of course, we now know that topical estrogens are known for triggering a variety of cancers. In fact, me 3 years ago got early uterine cancer from using a topical estrogen. Now, ironically, the reason why I chose to use oral estrogen, the reason why I chose to use an oral estrogen was because my mother has used an oral estrogen for 30, 40 years. And we have no estrogen-driven cancers in my family anywhere, my mother or my dad's side. There's no breast cancer. There's no cervical cancer, nothing. And so I thought I was safe. I thought genetics would be playing a role here for me and it would strengthen this. Well, nope. Leave it to me to be the first one in the family, to have something like this happen. And I asked my doctor, I said, wait a second, I thought genetics mattered. And he goes, no, not really. All it means is that you've just got cells that got turned on by the estrogen. And it's like, well, crap. Okay. So we stop the oral estrogen, but this brings us to topical estrogen. When you use a topical estrogen, it tends to stay where you put it. It does not, to the same degree that an oral estrogen would, get through to your bloodstream and circulate throughout your body. And so the safety studies for topical estrogen show that it is much, much safer than oral estrogen. And more importantly, it delivers the estrogen exactly where you need it, directly onto the skin. Now, one of the things that happens when women, I mean, it's really interesting, again, working with IC patients and our older patients is many of you, and I got to put this on me too. Our doctors will give us a prescription for an oral estrogen and we're like, why? And they go, well, it'll help. They don't necessarily really explain it. And we just don't understand the critical importance of the quality and health of your skin. If your vulva is dry and your vagina is dry, then so is your urethra and so is your bladder. And the fix for that is going to be potentially using, if you can, a topical estrogen. The second challenge that happens is when you do start using a topical estrogen, it's going to be hot as hell. You're going to put it down there and go, whoa, I don't like this. No, take it off. It doesn't mean the estrogen is burning you. That heat is a direct reflection of the quality and health of your skin. And what happens is every subsequent time you use it, the heat gets less and less and less as as those tissues are starting to use that estrogen to produce mucus. And so for me, it took about 2 weeks to go from the hot as hell phase to little tiny puff of warm air, like literally over in 5 seconds. Not painful at all. And so you don't want to be afraid of that heat that you might feel when you start trying an estrogen. Really, that's a testimony to the quality and health of your skin, right? All right. There's been a lot of talk also recently, and I don't have any evidence to support it, but and I might just have not seen it in the research journals yet, but quite a few doctors are starting to give patients a combination of estrogen and testosterone cream. I don't really have any information on that. I'm not aware of testosterone in any way helping to improve the gag layer of the bladder. I could be wrong. And I really haven't had a chance to talk with my medical board about it because everybody else is working with COVID. And guys, listen, I would really appreciate any prayers that you can send to urologists that are working with COVID patients. That includes our top IC researcher in the nation, Dr. Ken Peters at Beaumont Urology. His clinic has been inundated with COVID. They lost their first doctor who got COVID while treating patients. And we all had a big email last week, and the compassion from the other doctors in other parts of the country sent to him and sent to Rob Mulder in New York, who's also working with COVID patients or in that community, is just remarkable. What a time we are in. Also, I can talk about the COVID a little bit later if I want. So Jennifer is asking about pudendal nerve entrapment. So why does the pudendal nerve get entrapped? The pudendal nerve gets entrapped usually by you either pressing on it. You're either pressing on it like sitting on a bicycle seat where you're pressing on the nerve and it cannot function. And worse, you're damaging the blood vessels which support that nerve so that nerve can't function correctly. Or you got muscles so tight, they're squeezing that nerve. Oh, Henry over on YouTube says, I'm Dr. Peters' patient. Well, I hope you'll give him our best. Hendria, you also asked about Bladder Builder. You've been using Bladder Builder for a month. How long does it take before you notice improvement? You know, again, for any therapy, it's like a minimum of 3 months, but I think 6 to 8 weeks. I'd give it another couple weeks and see if it helps. I will say that for me, when I take Peora, which is the newest supplement called palmito ethanolamide, I can feel it within a couple of days, but it acts differently. It calms nerves down. It's not a bladder coating like Bladder Builder would be, although Bladder Builder does have some PEA in it. Interesting. Just a couple more weeks would be an interesting experiment. And Hendria too, remember, you guys remember, if you're one of those people where you do bladder therapy after bladder therapy after bladder therapy and you never get better, maybe it's not your bladder. Maybe your pelvic floor muscles are driving a big part of that. So Hendria, as Dr. Peter's patient, I mean, listen, the guy's a master diagnostician, absolutely one of the best in the world. Do you also have pelvic floor dysfunction? Do you have anything else going on besides your bladder wall? Hi, Tabitha. Hi, Jessica. Laura says, I bought a zero water picture. Big mistake. Turns out the water is very acidic, like 4.5. Pretty sure. Yeah, girl, hey, man, you're not alone. And that's why we don't recommend Brita water filters either. The really good water filters take out, I mean, when I say really good is the wrong word here. The really effective water filters take out all the minerals, but the minerals provide the pH balance. And unfortunately, what happens with these really, really strong water filters is they take out all the pH balancing minerals and you end up with acid water. And so we don't want you drinking acid water all day because acid is irritating, just like we don't want you drinking alkaline water all day. That's another mistake that patients make is they do too much alkaline water. And it doesn't matter if it's acid or alkaline, they're both going to hurt you. I mean, one a day would be fine, but your goal here is to be pH neutral at a level 7. We don't want you to be at a 5 or a 9. We want you to be at a pH of 7, ideally. Hendria says that was the next step we were going to explore before COVID hit. Well, be patient. We'll get through this, guys. We are in this together. We are a strong, hey, man, we are fighters. Like, really, you mess with the IC patients, we are going to fight back. We work so well together. We are supporting each other. We are comforting each other. We are empowering each other. Every time you guys go to a doctor, especially if you're going to have a hard conversation about something, I want you to pretend that there's 50 people standing right behind you, ready to fight on your behalf. We are there with you. We are sitting on your shoulders with you. We want you to walk in really confident, prepared to have that good conversation, good, effective conversations. But it begins with you, man. You guys got to do the work to learn, right? You can't, listen, the last thing you want to do is expect your doctor to teach you everything that he knows about IC or she, because the reality is if they don't have IC, they don't know what it's like to get through the day. They might know a little bit about therapies, but ultimately, in the end, you only get 10 to 15 minutes with them. And I will tell you that when I work with ICers, I spend 2 hours with them just on history and understanding their body. Most doctors don't have the opportunity to do that. And so if we can have you go through our checklist first so that when you get to the doctor, you can say, all right, doc, here's the thing. My symptoms started after a hysterectomy. I have a buzzing feeling when I sit down. Sex is uncomfortable. I cannot start my urine stream. Can you please help me understand what is triggering these symptoms? And any good doctor with those clues would go pelvic floor, right? You know, because if you have, well, anyway, I just totally forgot what I said. Okay, so with pelvic floor, you're going to have aching, you're going to have a burning sensation in your vagina because your pelvic floor muscles are too tight. You're going to have pain when you sit, potentially, or stand or move. If you've got tight pelvic floor muscles, you might be straining to empty your bladder because you can't relax. So you end up pushing, which is always a mistake, et cetera, et cetera. So if I can give you some of those really clean, crisp symptoms to help them diagnose you and study your body, that is a success. I hope that makes sense, does it? I hope so. Hendria says, you just taught me something about water. I thought my water had to be alkaline. What's a good pH? A good pH 7 water is a spring water. You just want a spring water. That's all. Just a plain bottle of spring water. I drink Arrowhead spring water or Calistoga spring water out here on the West Coast. You don't want Dasani, which comes from city water. Just look for a normal spring water. Teresa says, I have an extra vertebrae, so my tailbone is lower than it's supposed to be. It's painful, and I'm sure it bothers my bladder. Yeah, Teresa, isn't that so interesting? But it's probably not bothering your bladder. What it's doing is straining your pelvic floor muscles. It's tweaking your pelvic floor. That's a really interesting thing. The question is, where is the extra vertebrae? Is it in your sacrum, or is it in your spine? Or is it actually down there? Hi, Anita. Cynthia said, do you think sugar is not good for nerve pain? Well, sugar promotes inflammation, so we certainly don't want you chowing down on a lot of sugar. And again, if you're flaring when you're eating sugar, that really helps us also potentially look at candida and fungal infections. Heather says, what do you recommend to replace Elmeron? Any supplement that contains chondroitin. Any supplement that contains chondroitin. We had research presented at the European Society for the Study of IC meeting earlier this year, which showed that it is in fact chondroitin sulfate that helps to restore the integrity of these cells. Compared to all the other things, it was the chondroitin that improved surface integrity, especially if it was a chondroitin installation, bladder installation, which of course we don't have in the United States. So the closest thing that we have to that is going to be a supplement that contains chondroitin. And so those are going to be So the top supplements that contain chondroitin are going to be Bladder Builder, Bladder Rest, Cystoprotect, or Cystorenew. Now, Desert Harvest also has its own chondroitin aloe combination. I just don't have a bottle of that here. Cynthia says, what is good for a flare-up? Well, Cynthia, the question is what kind of flare are you having? Because there are different types of flares. So if you got a flare from intimacy or from sitting in a car for a long period of time, you're having a pelvic floor flare. So your protocol for a pelvic floor flare is to relax muscles. So you're going to be using heat. You're going to be maybe using a muscle relaxant, doing your stretches and your exercises you need to get those muscles to calm down and to help restore blood flow. You compare that with a bladder wall flare. If you have a bladder wall flare because you had coffee or soda or you went through chemo, our goal is different with that. Our goal is to calm and soothe the bladder wall. So usually the first thing you're going to do is drink water to dilute your urine, because right now your urine is filled with caustic, irritating things. So tip number one, drink a glass of water. That will dilute this and let's see, what word am I looking for? When you take a lot of vitamins and stuff like that, what happens is that your urine becomes this very caustic, kind of irritating stew of chemical byproducts and metabolites and things like that. And the same is true if you become dehydrated. If you become dehydrated, your urine goes from clear to yellow to brown, where it becomes much, 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 much more irritated. So number one, dilute your urine. The second thing you can do is alkalinize your urine. try to counteract some of the acid from the coffee. One of the ways that you can do that is by using pre-leaf, because pre-leaf is calcium glycerophosphate, and it does act to reduce the acid of anything that you might be eating. Or you can do what women have been doing for 100 years, and that is, or men too, a quarter teaspoon of baking soda in a glass of water. In a tall glass of water, quarter teaspoon of baking soda. That also does the same thing that pre-leaf will do. It will alkalinize your urine a little bit more. Now, you don't do that all day, once or twice is normal, but remember that baking soda is sodium bicarbonate, and that can raise your blood pressure. So that's why something like pre-leaf is usually preferred over something like baking soda, or you could even do a Tums. Tums also can help reduce some of the acid level. And then you might try a bladder anesthetic like Azo bladder pain relief tablets, the stuff that turns your urine orange, because that helps to numb your bladder wall. And then, girl, you got to write it out. You got to write it out. That bladder wall has been irritated, and for let's say a normal diet-induced flare, hopefully that flare will improve within 24 hours. Sometimes it will improve more quickly than that. It would be useful to, some people find Desert Harvest Aloe a little bit calming and soothing to those tender, irritated, fragile tissues. Or again, maybe making sure that you're taking one of the supplements, especially if you've got estrogen atrophy, and we know your bladder wall's super, super thin anyway. Having a little bit of extra coating in there just makes sense. That's where something like Elmeron, which is a bladder coating, or the chondroitin products would really shine. And for those of you who are wondering why Elmeron is an issue right now, it's because it's been linked to eye disease, pretty severe eye disease, retinal disease. Oh, my friends, I have news. 2 more lawsuits have been filed. 2 more lawsuits have been filed, this time in the district court of, where did she say? Not in Connecticut, maybe New York. So anyway, so now we have a total of 3 lawsuits filed on behalf of IC patients who have developed retinal disease because of their use of Elmeron. I also have, by the way, she has sent me a Q&A to help you, for those of you who have issues with your eyes and Elmeron, that will kind of walk you through that process, and maybe later in this meeting I can read those. Teresa says, it hurts when I'm peeing and after, like for 5 minutes. Okay, so Teresa, then that's really not your bladder wall. Because if it were your bladder wall, it would hurt as your bladder was filling. So the fact that it's hurting while you're peeing and afterwards either points to estrogen atrophy in your urethra, on your vulva, or muscle tension. If you are, normally when you pee, you sit down on the toilet, a muscle relaxes, a sphincter opens, you pee, and it's pretty much instantaneous. If you cannot start your urine stream right away, if you hesitate 5, 10, 15, 20, 30 seconds, a minute, 2 minutes before you can relax enough to empty your bladder, that points again to tight pelvic floor muscles. Billy says, can you explain why it hurts before I pee? Then I feel so much better. Because Billy, here, hold on. I got that question. I can answer that question for sure. So let me show you some pictures here. So these are pictures of Hunner's lesions or Hunner's ulcers. So this is considered the worst form of IC. And I want you to look, like here's a bladder that has a couple of ulcers on it. Here's one really big ulcer, and it's characterized by having radiating arms of irritation. Like, look at this one too. Look at that. This is just radiating all around this. Now, So this is an open wound, right? So imagine urine filling your bladder. The fuller it gets, the more the urine comes into contact with the wound and or enters the wound, which is why it's like, oh hell, where's the bathroom? This hurts really bad, right? And so obviously in this case, if you've got a big bloody bleeding ulcer or lesion and your urine gets into that lesion, it's going to hurt like hell. And then as soon as you pee, bam, doesn't hurt because urine's no longer touching the wound. So again, this is Hunter's lesions. But now let's look at this. This is a picture. This is more a picture of an injured bladder wall. These are not lesions. These are something called petechial hemorrhages, or glomulations. And so this is a sign of a bladder wall that's been injured by something, really, or it could be an inflammatory process from nerves that have been injured by tight muscle. Anyway, it's a long story. I've talked about that before. It's called the somatovisceral reflex. Okay, that's a whole. I don't want to go off topic here. Okay, but look at, obviously this bladder has a lot of irritated areas to it. So again, as your bladder's getting fuller and fuller and fuller and fuller, urine is getting into every one of those wounds. And it's like, ow, ow, oh my God, ow, ow, oh my God, I need to get to a bathroom. And then bam, you pee, no longer touching the wound, you feel better. You know, it's so, see, I think for me, one of the things that really helped me kind of understand IC and get better was when I started thinking of IC not as a disease, but as an injury. Because mine was an injury. I had a major chemical burn from a swimming pool accident where the pool that I was training in made a massive mistake with the chemicals. One day, 5 or 6 of us swam, and I woke up that night with agonizing bladder pain. And I called the pool and I said, is anything weird going on? And they said, why? And I said, because I swam yesterday. And they interrupted me, the manager, and said, you swam? And I was like, yeah. They go, wasn't the pool sign up? No. A bunch of us swam. We would have been blinded if we hadn't been wearing our goggles. They had just done a massive chemical bomb of the pool like an hour before we got into the pool. Oh, and I think I've since worked with probably 50 to 75 patients that this has also happened to, usually in hot tubs rather than pool, including a major swimming coach. And so, you know, so my first diagnosis was chemical cystitis the next day. I mean, it was, the doctor said, yeah, you definitely have a chemical burn. There's no doubt about that. But I don't know, you know, what do you hear? You hear disease, disease, disease. And people say drink cranberry, cranberry, cranberry. And really our only depth of experience with the bladder is with infection. So we all really focus on a disease process. And it wasn't until like a year or two later that it was like, wait a second. It's not a disease. You were burned. It's hurt. And that may help me make a lot better choices about my food. Because before I was just like thinking, I'm not going to let this rob me of what I enjoy. And I wanted to continue to drink the coffees and the sodas and stuff like that. And I did, and I had terrible flares. But then at some point in time, this concept of, wait a second, would you pour acid on a wound on your hand? No. And why are you pouring acid on a wound on your bladder? And once I made that connection, and what this was 27 years ago, 26 years ago, and I started making better choices, and I realized that my goal was to create an environment that would support my bladder healing. Oh, things got so much better. And now I'm symptom free. And my bladder, if you looked at my bladder, there's no wounds anymore. I'm living proof that you can heal. I'm absolutely living proof that healing happens. And if you're wondering what I'm drinking, it is a rooibos tea. It is not coffee. Laura says, does Lexapro cause flares in some people? I've been flaring all week and can't get it under control. Well, let's look. Hold on a sec. Let me look. I off the top of my head, I can't remember anybody saying that, but let's see. Well, it can cause abnormal bleeding. So the common side effects of Lexapro, let's see. Agitation, restlessness, blurred vision, diarrhea, difficulty sleeping, drowsiness, dry mouth. Okay, so dry mouth is important here because if it's drying your mouth out, you have to wonder if it's also drying out other tissues. But here it is, girl. Frequent urination. Frequent urination. So your answer is, can Lexapro be triggering a flare? And the answer is absolutely, because it will increase your need to use the restroom. Dry mouth, fever, frequent urination, headache, indigestion, nausea, increased or decreased appetite, increased sweating, sexual difficulties, taste alterations, tremor, and weight changes. So I think that, Laura, the answer to your question is going to be yes. Hold on, my computer keeps voting. Linda says the estrogen brought out your IC. It was the most horrible thing ever been through. It caused your bladder to spasm constantly. So Linda, let's see. So concept number one is there are some estrogen products that are very junky. They have a lot of extra ingredients in it that create a lot of extra irritation, especially Premarin. So Premarin comes from pregnant mare urine. It's Premarin, so pregnant mare urine. It's that really despicable industry up in Canada that where they keep these draft horses pregnant, basically just kill the babies, and they just capture their pee and extract the estrogen from the pee. The problem with Premarin is that they use a lot of extra chemicals and preservatives in it, and it is notorious for causing more pain and discomfort. In fact, I first learned about that. I mean, they gave me Premarin back, you know what, when I was in my 20s with vulvodynia. It burned like hell. Ow. Ooh, ow, ow, ow. Oh, ow. There have been books and articles written about the hazards, the side effects and potential hazards of Premarin. And one of them, it was this book, Screaming to Be Heard, Hormonal Connections That Women Suspect and Doctors Ignore. And she has a whole section in here on Premarin. Let's see. So if it was Premarin, it wasn't the estrogen that was triggering you, hon. It was all the other stuff. Let's see here. Well, anyway, that's a little too academic to talk about here. So that would be one of the things that I would look at, hon. The other thing is I would definitely talk to your gynecologist, because maybe you need a combination of estrogen and testosterone. I mean, this is a whole new area that's changing. I'm sorry you had that reaction, but it doesn't surprise me. We see that all the time. And all I can tell you is the Premarin burns me too. I do a compounded preservative-free estrogen cream that I get from a compounding pharmacy called the Women's International Pharmacy. They're based in Arizona. Their website is women'sinternational.com. And they specialize in custom hormone formulas for people who are super, super sensitive like I am. And I've never had a problem with theirs. Lisa, I've been diagnosed with pubic symphysis joint pain. I've had an injection 3 months ago to relieve the pain, but it made it worse. Any ideas for helping with the pain other than using the belt ice strengthening muscles? I'm in pain all the time and I'm taking too much ibuprofen. You know, Lisa, gosh, I saw a discussion about this. And it was either here or might have been here. Hold on a sec. I don't think. I know that I have read, this is a book, Ending Pelvic Pain, Ending Pain in Pregnancy. I think it might have been in this book. Let me see. Oh, had to have been this book. There's a whole section on the pubic bone. Let's see. Let me see if I can find it. Let's see. See, you know, you, Lisa, I'm really glad you're here right now because you're reminding us all that there can be structural issues, mechanical issues, which can be triggering IC symptoms and pain. Whether you've got one leg longer than the other, whether you've got your feet messed up or your knees messed up or your hips messed up, or you're having a joint issue like you're having. You know what, girl, give me a call this week. I mean, I'm going to have to dig. Wait. Come on. No, here it is. Chapter 7, Symphysis Pubic Dysfunction, Trade Secrets that Reduce Pain in Ending Pain in Pregnancy. Yeah, babe. All right. Let's see what they say here. While symphysis pubic dysfunction or pubic bone pain is common during pregnancy, it is not a normal part of the pregnancy journey. Yes, something can be common yet not normal. Pregnant women suffer in silence with this pain and seek no help, or worse yet, are not advised to try physical therapy. Unfortunately, many OBGYNs and midwives believe that certain types of aches and pains are a routine part of pregnancy and are unaware that pregnant women can be helped with conservative physical therapy. This is the belief culture here in the US, but I will prove to you that there is much more you can do, not only with a physical therapist, but on your own to alleviate your pain and symptoms. In this chapter, you will learn massage therapy, trigger point releases, protection and injury strategies. You also learn how to align your pubic symphysis joint. Lisa, this is it. So let's see. So the two pubic bones are connected by cartilage and ligaments, and this connection is called the pubic symphysis. This dysfunction results when the pubic symphysis moves excessively, separates or misaligns, creating instability and contributing to high levels of pain. It is normal for the pubic bones to separate during pregnancy to make room for the baby, but if the separation is too great or there is excessive movement, the end result can be pain of a greater magnitude. SPD can start as early as first trimester, when the relaxin hormone is at its highest, or can begin later on in the pregnancy as the hips begin to widen to allow the baby to position for delivery. Pubic bone pain can have debilitating effects on the lives of pregnant women. I see pregnant women using canes and wheelchairs because they simply cannot walk due to this severe pain. By the time a pregnant woman from this pain comes to my center, she's often at her wit's end. Up to 45% of pregnant women suffer this. All right. So, this is cool. This is it. I'm so glad I remembered this. You know, I sometimes I have trouble remembering little things, but the fact that I remembered that this was in this book is cool. Also, look, hon, she's got a whole section on this. Reducing your pain. She talks about sleeping, how to correct your pubic bone area, avoid getting, oh, yeah, girl. This is it. This is it. Okay. So I think you might benefit from getting this book. Okay. I mean, it talks about it when it happens when you're pregnant, but also things you can do after your pregnancy. All right. Yes. All right. Get that book out of the way. Hello, Simona. So you guys, I am simulcasting live on Facebook and YouTube. When I'm looking up here, I'm looking at Facebook. When I'm looking down here, I'm looking at YouTube. Hello, Michelle on YouTube. Nice to see you. Hi, Sherry. Sherry says the quality of the audio on YouTube is better today. That's good. Suzanne says, would you go to a gynecologist or a urologist to discuss estrogen atrophy? Either one, they both should be able to see it. I mean, it was my urologist who saw it first, not my gynecologist. And it was my urologist who prescribed the estrogen cream. Anita says, what about reverse osmosis water? I don't know. I don't know. I mean, osmosis, okay, if I remember chemistry, if I remember my chemistry days, okay. Hold on. Man, y'all are challenging me, and that is a good thing. You're keeping me on it. I just don't remember what happens to the minerals in reverse osmosis. It's a water purification process that uses partially permeable membrane to remove ions, unwanted molecules, and larger particles from drinking water, applying an external pressure to reverse the natural flow of the pure solvent is reverse os water. So it says it can remove the good with the bad. It could remove iron, calcium, manganese, and fluoride, thus putting people at risk for cavities. I don't know. It doesn't sound good to me. I mean, I would just be doing spring water. Angie said, had a phone appointment with my new pain doctor. She told me to wean off my current pain med, that I also cannot have my vaginal Valium. What? She didn't want to hear discuss pelvic floor or IC. What? She said she'd schedule an MRI of my lower back, providing I've stopped my pain meds and my Valium. She will then determine what spine injections and physical therapy I need for my back. Definitely doesn't care about my pain as a whole, just back pain. Not sure what to do. Not a lot of options. Ooh, girl. Ee. Well, I mean, at one point, listen. You know me, I don't like guessing, I like facts. And if she is trying to figure out if your back is a source of your pain, then there's value to that. The problem is that if you've got tight pelvic floor muscles, so I don't understand why she would want you off the muscle relaxant. Maybe if she, remember, some pain doctors are I mean, there are two different types of pain doctors. There's one group of pain doctors who understand that pain is multifaceted and that a multimodal approach to therapy is important, and that they're going to look at a lot of different things to try to really help that patient, and they're very compassionate. Other pain doctors, their clinics are based on getting people off of drugs. And they come at more from the perspective of maybe this patient is an addict. And the challenge is that the Valium that you're taking is potentially addictive. So I guess the question is, would you be allowed to use baclofen, which is a non-sedating muscle relaxant to keep your muscles calm and relaxed? That would be number one is, listen, my muscles are super tight. I'm having trouble peeing. We got to figure out a way for me to urinate successfully, and using a muscle relaxant is helpful. So you could ask her if the baclofen would be a reasonable option. And I don't know what to say about the pain meds, hon. If you, because I don't know how much you're taking. Ultimately, in the end, the thing that I continue to say to patients is, yes, we got to try to get you through the day, no doubt about that. But we also have to we also have to figure out what the hell is triggering the pain in the first place. I've worked with some women and men who have been on pain meds for years, and they never ask what's hurting. What is hurting? Is it a joint? Is it an organ? Is it a nerve? Is it something with my spinal cord? And so ultimately, that also has to be a big part of your work, is trying to get an answer as to what is causing your pain, like pubic symphysis or SI dysfunction or a Tarlov cyst, anything at all like that. And I think it's very cool that she's willing to do an MRI, but she's blackmailing you. She's saying she won't do the MRI until you're off of your pain meds and your Valium. That doesn't feel right to me. I mean, you say that you have spondylosis and spinal stenosis. So I guess the question is the spondylosis also triggering your pelvic pain and the spinal stenosis? I don't know, hon. You're in a hard spot, hon. You're in a hard spot. I don't know what to tell you. What does your orthopedic surgeon say? I mean, could you possibly go to your orthopedic surgeon to get the MRI, or a physical medicine doctor to get the MRI to have a better understanding of what's going on with your back? Lisa says, what about water softeners that replace the calcium with sodium? Is that bad for IC? I have had, over the years, a number of patients call who have complained about water softeners. So it's possible. Danielle says, wow, I've been using Brita for years. Thanks for the info. Yeah. Teresa says, this whole thing started when I was 16 and had a terrible catheter. It was super painful and you never peed right again. So Teresa, I mean, two things can happen with that. Well, number one, why did you need a catheter in the first place? Number two, was your urethra damaged by the catheter in some way? Or number three, did your pelvic floor muscles just lock down super tight because of the pain and they just hasn't released yet? That you've been basically living with tight pelvic floor muscles triggered by that. You've got 3 layers of muscles in your pelvis. So imagine your joints. So if you were to stick your finger up your vagina, you would have shallow muscles, mid-level muscles, and deeper muscles. It's the shallow muscles, the urethral diaphragm muscles, that when they get tight, you have trouble with frequency, urgency, and getting things up and down your urethra and your vagina. Melissa says, I'm going to try pelvic physical therapy. This will be my first go with it. I have so much pain standing with work. All right. So, Melissa, you are an anatomical mystery to be solved. And I'm going to tell you right now that most patients with quote unquote pelvic floor dysfunction, they have more pain sitting than standing. So that makes you really, really interesting to me. Normally, when you go to the pelvic floor physical therapist, that first examination is the most important one because you, again, are an anatomical mystery to be solved. Their purpose is to study your pelvis, study your body, study anything that would be influencing how your pelvis is performing. And so normally they would watch you walk down a hallway. Are you walking straight or are you walking to the side like this? If you're walking to the side in little tiny arches, that will hopefully have them look at a hip or at an SI joint. But we also need them to look at your knees, to look at your feet, to see if there's something dysfunctional about how you're standing that is directing abnormal forces up your legs, up your muscles, into your pelvis. And the book which really talks about that is this book. Everybody should get this book, Breaking Through Chronic Pelvic Pain, a Holistic Approach for Relief. It is free on Kindle Unlimited. On regular Kindle, it's $9. You can buy it from our store if you prefer the book so that you can highlight it. This book is a master class at pelvic anatomy, and his discussion in this book of the feet and the knees and how the legs can direct and misdirect forces to different parts of the pelvic floor is important. So, Melissa, it's not just about looking at your pelvis, it's about looking at what is influencing your pelvis. And so, you want to have that discussion with her. And I'm telling you, the chapter on feet in this will knock your socks off because what Dr. Weiss found in his practice is that 90% of the IC patient, pelvic pain patients who kept coming back over and over and over and over with muscle tension had foot problems. And when they finally corrected the foot issues, and how they were walking, the pelvis was no longer traumatized. The pelvic floor was no longer tight. And if I can give you an example here. The other thing I want you to be attentive to during that first examination is that they're going to study your body inside and out. Okay, so after they do the external, they're going to do an internal exam. You're going to be laying on your back. You're not in stirrups. It's not that creepy. And what the physical therapist would normally be doing is gently touching the structures in your pelvis. So this is your pelvis. So we're going to have finger going up, and they're going to touch the lower muscles, the mid-level muscles, the higher muscles. They're going to check the levator muscles, which go from front to back. And they're also going to feel the muscles that go up and along the inside of your hip bones, your piriformis muscle, and that muscle group there. And listen, if she can touch something and trigger your pain, that is a hallelujah moment. That is exactly what we want to see. That is exactly what we want to see. So if you have pain during your first appointment, that is a tremendous success because that means they found it and they're touching it. And that's when you go, okay, that's it. What are you touching? Tell me right now, what are you touching? What muscle group are you touching? Because in the end, we'd like for you to walk out of that appointment with the names of the muscles that are screwed up. For me, it's my left piriformis is my dominant issue at this point in time. So that you can then come back and do a little bit more research on how to rehabilitate that. And she will give you exercises that you can do at home. They might recommend that you use a glass wand, which is what I do, which which is right here. There are moments when you start to go into tension on a weekend and you can't get to the doctor. So what are you going to do? Well, if you have a glass wand and they teach you how to use it, you might be able to get in there and, basically you kind of rub along the length of the muscle to get that much. So think about it. Your muscle can be kind of locked down like this. So you just very gently rub along the muscle to try to get that muscle back to its proper length and proper consistency. Or they might have you rubbing across the muscle, or they might have you do a little bit of low work or a little bit of mid-level work, or they might even have you press on a trigger point if you happen to have a trigger point there. So I'm really, really, really glad that you're going to that pelvic floor physical therapy appointment, because your bladder shouldn't hurt when you're standing. The bladder does not hurt positionally. What hurts positionally is muscles. And so I think yours is going to be fascinating. And I really, really think it's very important, given the fact that you have pain when you're standing at work, you got to get this and read the chapter on the feet, because it could actually be your foot. But it might be something else. There might be something else that you're doing. I was working with some steel workers who, two steel workers in the same week. One, a guy in his early 20s, like 24 years old, and another guy in his 60s, and they had exactly the same icy pain. And it was because at work, they had to do this to lift something up. They're very heavy, brutal work, working in a steel mill. Teresa says, it's in my spine. It's L6, it's what they call it on the x-rays and the CAT scan. Okay, so if they found it, why does she want to do an MRI again? Is she thinking that they're going to do maybe nerve blocks or something like that? Hi, Sherry. Sherry says, better late than never. Sherry, we were all late. Facebook made me quite late again because they forced me to download software with no notice. So Rhonda says, it's weird that pre-leaf constipates you. I don't know if I understand biologically why calcium would constipate you, but I totally believe you. We're all different. Julie says, just diagnosed last week, looking for information. Okay, well, Julie, I hope that this helps. I mean, hopefully I've given you a little bit of context here. If you're still here and you've got questions, feel free. Remember, you are an anatomical mystery to be solved. We're looking at the condition of your bladder. We're looking at the quality and health of your skin, your muscles, your nerves, central sensitization, genetics. If you have anybody in your family that also is struggling with bladder issues, those all matter. If you go to the top of our Facebook page, I've got a video on the 5 IC subtypes, and I would start with that. Start with that, okay? Tanisha is going to have a cysto tomorrow. Tanisha, are you going to have a hydrodistension with cysto or just a cysto? Elizabeth says, I've been going through electroconvulsive shock therapy and they use ketamine for anesthesia. Is ketamine bad for the bladder? It can be, Elizabeth, it can be if they use too much of it. And so in small doses, ketamine can help reduce pain. But in larger doses, ketamine does act a bit like a solvent in the urinary tract. And so if you, after they give you ketamine, if you notice frequency, urgency, or blood in your urine, you need to tell them, because they're probably going to need to back off on it a little bit, not use quite as much. I have a website called ketaminecystitis.org you might want to go look at. Shannon says, I'm scared. I'm going to have Botox on my bladder next week. I've had 6 injections already and they didn't help. Well, hun, if you've had 6 injections and they didn't help, why are you doing it? Why are you going back for more? You know, the American Urology Association guidelines for IC bring up a couple of key critical principles that they want every doctor to follow. Concept number one is if a patient is not responding to therapy, take a step back and revisit the diagnosis. Do we know what we're treating? Have we missed something? Is that, you know, and have we missed pelvic floor? Have we missed pudendal neuralgia? Is some a fibroid tumor, endometriosis, something else that could be involving the bladder? And then the second thing that they say is if a patient is not responding to that therapy, why continue it? Move on. And so I'm curious as to why they want to do it again. I mean, listen, so you've done it once and it didn't help, and you say 6 injections. Are you saying that you've had Botox done 6 separate times? Or are you saying that you had it done once and they gave you 6 injections? If you've done it 6 times and it hasn't helped you 6 times, why would you continue? Wouldn't it be time to try something else? Billy Tyne says, what heals Hunner's lesions? Billy, we know that Lyris, also known as the lidocaine pretzel, heals Hunner's lesions. Lyris is a medical device that is filled with lidocaine. And what they do is they put it in your bladder where for 2 weeks it numbs your bladder wall. It was originally created, and their intention was that it would be used for pain, for people who struggled with bladder pain. But they were stunned in their very first Lyris study to see that every single patient who had Hunner's lesions had their lesions heal completely. The quote in the research study that was presented at the AUA was, a complete and total resolution of the lesion, a complete and total resolution of the lesion. And that was stunning. That stunned everybody. First treatment in history to heal Hunner's lesions without surgery, without scar tissue, et cetera, et cetera. Unfortunately, you can't get it right now. Allergan, the company, has it, and they have shelved it. They have, quote unquote, deprioritized it. And so your next second guess that would not leave scar tissue behind would be hyperbaric oxygen therapy or a steroid injection into the center of the lesion. The other way that Hunner's lesions are treated is going to be with laser therapy or cauterization, fulguration. The challenge with that is it will leave scar tissue, and wherever you have that scar tissue, that bladder cannot expand. So it will start to limit your bladder capacity. Because remember, the cool thing about your bladder is that it stretches. And I think it's really interesting how tissue that starts like this can stretch like this. But wherever you have scar tissue, it won't stretch. I have a whole section on Hunner's lesions over on our website, icnetwork.org. Shannon says, I take pre-leaf before I eat or drink anything. It helps. Stress is my main trigger. Yeah, I think we're all getting lessons in stress management right now, right? It's pretty crazy. Life is pretty crazy right now. Becky says, I use compounded estradiol and testosterone cream in a VersaCare base. I love it. It helps me so much. Becky, did they ever explain to you what the purpose of the testosterone was and what does that do specifically to the cells and the tissue? Teresa says, does marijuana help IC? I've heard many different things about it. Teresa, I went over this in our meeting last week. We at the IC network did the longest study and largest study on marijuana with IC. It was a 6-year study. And basically, and I read all the results off last week. Basically, it didn't help everybody. About 25% of the people reported that their symptoms went away, and the research study broke it out separated urgency, frequency, pain, other things. So about 25% of people had it dramatically improved their symptoms. Another 25%, 50% improved their conditions, 50% or their symptoms. Another group said it improved them, but not as much, 25%. And then there was a small group of people, 25%, that it didn't help at all. But in my opinion, I think that especially in this era where you're being deprived of pain care, I certainly think it's a viable alternative, and we're trying. But you got to be really, really careful here with medical marijuana. We had a very interesting case down in Los Angeles a couple of years ago, where there was a gentleman with a absolutely really, really, really bad pain condition, and he had used it successfully for a couple of years. And then all of a sudden, he started feeling like he was getting poisoned. And he thought, I wonder if it's the marijuana that he was buying from his dispensary. And he had it tested, and it was filled with pesticides. He was absolutely getting poisoned from it. And it was quote unquote organic. So then he called a local TV station in Southern California, and they went and tested a whole bunch of marijuana, lots of different brands from a lot of different dispensaries. And they found pesticide levels in most of them. And even ones that said organic still had pesticide contamination and fungicide contamination. So the lesson that we learned from that study is that whatever brand you want to get, God knows there's a lot of them, you have to look at testing results. Don't believe the people in the dispensary. You want to see the sheet of paper that proves it, or something on their website that proves that it is being tested. Now, I will tell you that medical marijuana was brought up 2 years ago in the IC class taught at the American Urology Association. It was brought up by one of the speakers, Jennifer Fariello. And and she had a brand. Hold on, let me see if I can find it. Here it is. So for those of you who are members of the IC Network, and this is our summer 2018 issue. And the class on IC and pelvic pain that I went to, it was just stunningly good. And so I highlighted it in this magazine. Just wonderful, wonderful class taught by Robert Evans, the top IC clinician in the country at Wake Forest, Robert Moldwin in New York. Also, he's the author of the IC Survival Guide. And Robert Moldwin's wife, Jennifer Fariello Moldwin, who is an outstanding nurse practitioner who works with IC patients. And she was talking about vulvodynia. And she was the one who brought up the medical marijuana. And here it is, right here. Medical marijuana was first used in patients struggling with multiple sclerosis. In a double-blind placebo-controlled study, it decreased nighttime urination by 30%. How? The bladder contains cannabinoid receptors CB1, CB2, making it a viable target for treatment. Medical marijuana acts to inhibit directly on the smooth muscle of the bladder. It has been delivered directly into the bladder as algolemic acid, as an instillation. And Ms. Moldwin shared that they are seeing great success using medical marijuana suppositories, specifically mentioning Fair Winds cannabis. Fair, like a fair day, wind. Fair Winds cannabis, who have infused vaginal suppositories called Feminine Relief and infused rectal suppositories called Rectify. So the medical marijuana, good question. And again, that's not me talking about it. That's literally top IC clinicians in the country talking about this. Angie says, yes, tight muscles have caused my back problems, and I had IC and pelvic floor dysfunction way before back problems. All right, Angie, then you know what you do. Then got to work on those muscles. But the question, Angie, again, is why are your muscles consistently and chronically tight? And what Dr. Weiss says in this book, Jerome Weiss, the author of this book, he wrote this book in 15 years. He's retired now. He's I think about 80 years old now. When he started practicing in the 60s, he was very, very frustrated that IC therapies didn't bring relief. And that pelvic pain therapies did not provide permanent relief. And he embarked upon this journey to study the pelvis like nobody had ever studied it before. And ultimately, he ended up becoming a myofascial pain specialist. And so he has spent years, 30 years, working with muscles and tendons and ligaments and bones, trying to understand how they interrelate with each other and how they influence each other. We know, for example, that organs can change muscles. We know that the bladder, if it is screaming in pain, is going to make your pelvic floor muscles tight. We also know that muscles can change organs, that if your muscles are chronically tight, that too is potentially going to change your bladder. But the thing about this book that's so fascinating to me are the case studies he shares, because he became a master at releasing pain. Releasing tight muscles and trigger points. If you came to his clinic and you had trigger points, he could get rid of them for you. He could get those muscles calmed down. And if you had tight dysfunctional nerves, not tight nerves, dysfunctional nerves, painful nerves, he could fix that too. He could get that calmed down too. But what fascinated him and frustrated him was, why did this patient come back 2 weeks later, a month later, with the exact same tension? And why did the trigger points come back in the exact same spot? And ultimately, what it comes down to is a mechanical abnormality. That there is something in your bony abnormality, or your bony structures, that is abnormal, that is constantly taking or creating or triggering tension in your pelvic floor. So if you have one leg longer than the other, so look, this is going to be exaggerated, right? But if I have one hip longer than the other, and I'm walking like this, right? So if you're walking like this, that's exaggerated. It could be really subtle, man. It could be 1/4 of an inch. Not an inch. This is how my mother walked, because she has a bad hip. So this is the way my mother walks right now. If she's not using her cane, you can damn well bet her pelvic floor is a mess. So what he talks about in this book is he makes a connection that if your feet are abnormal, if you've got one leg longer than the other, if you're overpronating, if you're pigeon-toed, if you have plantar fasciitis, shin splints, if you've got Morton's toe, Morton's neuroma, if you've had any other foot diagnoses in addition to your tight muscles, the answer is probably in your feet, not in your pelvis. The pelvis is a reflection of the foot problem. And what he found in his clinic is that 90% of the patients who kept coming back over and over and over and over again with these tight muscles, when they fixed their feet, that was the solution. So please, Angie, get this book. It's free on Kindle Unlimited. You can't get a better deal than that. And Kindle, you could just sign up for Kindle Unlimited for a month and read it for free. So they have a free month. So literally that would be a way to do it. But if you're like me, man, I study. So I always get the paper books so that I can draw on it and do all this other stuff, because I really need to learn it. So for me, whenever I read a book like this, it's like I'm back in college and I studied the same way I studied in college. Mary says, thankful that in addition to IC, I also have several spinal compression fractures, so I'm fortunate to be able to get opiate pain meds. Yeah. Angie says, yes, I feel blackmailed. I would feel blackmailed too, hon. I mean, it certainly something doesn't feel right in that situation. But Angie, what about an orthopedic surgeon? Have you seen a spinal surgeon, an orthopedic surgeon? Oh, you were going into surgery for your appendix. Interesting. So Shannon says, see, I'm the same. Sitting feels better for me than standing. Okay, so Shannon, that to me points to your legs and to your feet as the source of the problem. I don't know if I can show you this picture really well. So look, it's so hard to do. No, okay, so look at this. This is a picture. Okay, look, this is a picture of somebody whose ankle is rolling inward. So this is the normal foot. This is the abnormal foot. So you can see with the normal foot, the forces when you walk go straight up. But look at what happens on this leg. Everything starts to point outwards. And if you can see here, what that does is that stretches the piriformis muscle up here. And the obturator, I think it's the obturator muscle. Yeah, it's the obturator muscle. And then it can start involving ligaments and stretching ligaments out too. And so that is exactly why, if you think about it, if you're standing funky, that could explain why you have problems. Also, listen, let me just show you, shoes matter. And there's one brand of shoes that is perfect, and it's called Hoka One One. Hoka One One, HOKA 11. So hokaoneone.com. Hold on a second. Let me go get one of my pairs. I don't know if you are allowed to wear, you do, but if you're in a situation where you can wear shoes, Hokas are, they're recommended by every podiatrist. I live in these all day. I've got 6 pairs of them now that I bought over the last 3 years. And you'll see that the padding is incredible. I mean, it's just the best shoes ever. This is the Arahi 2, but I'm now wearing the Bondi 6s, which are even plusher and are much more comfortable to stand in. And I can't, like, I totally miss my Birkenstocks. I couldn't wear Birkenstocks 5 minutes right now. But I can wear these and I can stand for long periods of time and I can walk for miles and my feet don't hurt anymore. I think it's so fascinating. I feel like I want to call Dr. Weiss and talk to him about that. Brenda says, I'm 75 years old. I've had IC bad for over a month. They're going to do surgery to see if there's something wrong with it. So Brenda, what kind of surgery are they going to do? Are they going to just do a hydrodistension with cystoscopy and look in your bladder? Or are they doing exploratory surgery and maybe looking at your uterus too and stuff like that? Edith says sitting is worse for me. And again, Dr. Weiss in his book says really that anytime a patient has trouble sitting, he's always looking at muscles influencing the pudendal nerve. He said that sitting is the gold standard. If you have pain with sitting, that absolutely tells us that your pudendal nerve is being compromised in some way, probably by tight muscles. Oh, Mary says, this explains a lot. I've always had pelvic floor dysfunction, but never associated that with the fact that I was born with hip dysplasia. Exactly. Exactly. Sherry says, I have to turn the volume way up on here today. YouTube has better audio than Facebook. Oh, I'm sorry. Julie says, the book is incredible. I started it last weekend. We'll finish this week. I have an appointment with Dr. Peters at Beaumont. And guys, listen, remember, what's my rule? What is my number one rule when you go to a new doctor? My number one rule is don't walk in and say, I've got IC. I want you to go in and I want you to be as specific as you can about your symptoms. And say, doctor, I'm here because I have this symptom and this symptom and this symptom. It hurts here to the left. It hurts here this. I have this or that. I am here because I want you to tell me what structures in my pelvis can be triggering this. Yeah, don't tell them you have IC. And I'm going to say that's especially true for a gynecologist because we also want the gynecologist to make sure they're ruling out other things that we know will influence the bladder. Could you have fibroid tumors pushing on your bladder? Could you have endometriosis attached to your bladder wall? Those are important to rule out. Over on our website, I have a huge section on confusable conditions. And you know what, guys? Hold on a sec. I wanted to see it because Facebook keeps changing everything. And I saw something about being able to share my screen. No, it won't let me do it. It won't let me. Do it in the middle of the meeting. That's why if we weren't simulcasting on 2 platforms, I would be able to do that. But unfortunately, we are simulcasting right now. Oh, wait. Oh God. Wait. Ah, Facebook, I almost closed you. Sorry. All right. Lynn says, I've gotten an amazing amount of info from you today. Thank you. Well, I started out a little bit slow. It takes me a little bit to work myself up. Sorry about that. Cynthia says, you're amazing. Thank you. You guys, listen, if you find these helpful, please consider becoming a member of the IC Network so that you can get this wonderful magazine, which I write with a couple of my staff. We're working on the spring one, finishing up the spring one right now, spring 2020. But you can get this for as little as $25 a year, and your memberships really help us stay afloat. You can also make donations to the IC Network if you feel like it, or if you're on Facebook, you can give us stars. Becky says, pre-leaf calcium aggravates my constipation too. All right. Shannon says, I do have endo. Shannon says, no, the Elmeron injection, it's a series. Well, it's not the Elmeron injection, it's the Botox. It's a series of, okay. Wait a second, Shannon, are you talking about an installation where they're putting a fluid in your bladder? Or are you talking about an injection where they stick a needle into your bladder wall and they put a medicine in your bladder wall? And Shannon says, my mom also has IC. So does my mom. So does my sister. So does my grandmother, my cousin. There's heredity in our family related to the supersensitivity. Any link between having COVID and an IC flare? Well, hun, there's so much. I mean, Laura, a girl, let me tell you, the stress that we are living in right now is stunning and remarkable. And anybody who is flaring because they are stuck at home and they're starting to worry about money and they lose their jobs, yeah, you're probably going to have a stress flare. And for all of you out there, you are not alone. Oh my God, this has changed every facet of our lives right now. So of course, the stress from that is astronomical. And this is when you've got to do a lot of self-care, and thankfully summer is almost here, so we can go sit in the sunshine. But please, 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 you guys, don't go into crowds without a mask. Don't go into crowds. And it's probably going to be for the rest of the year, maybe even a good portion of next year. This is big. You know, when I got my pharmacology at UC Santa Barbara, the first class I took was a public health class on HIV. And in the very first class I took on that, the very first lecture talked about what they were worried about. What they were worried about was mutations. And they really thought back in the early 1990s that HIV would become an airborne infection as compared to a sex transferred or touch infection. Thankfully, that didn't happen. Unfortunately, COVID is an airborne infection that has now mutated a couple of times. The second mutation is actually more severe than the first mutation. And what I was reading, again, a public health article about it, what it's stunning them is that the second mutation has now, that first big mutation has now dominated and moved everywhere. And it's more intensive than the original COVID. And so please, 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 guys, I don't care if you live in a state with a governor who says it's safe and get out and do your stuff. Do not get out and do your stuff. We all have to protect ourselves right now. Because this is not a political decision. This is a medical decision. This is a virus that is transferable by air and touch. And I don't know if you saw it today at one of the Wisconsin, it was I think it was the Wisconsin or the Minnesota rally 2 weeks ago, where they were rallying to open the doors. 72 people at the demonstration now have COVID because of the demonstration. So please just stay home. Okay, as much as you can. This is not the time to get out and do stuff. And I'm sorry for talking about it. So the other thing that we know about COVID is it is found in sperm. And that was research that was done in China. So we know that men who have had COVID, that the virus is found in sperm for a specific, for a period of time. And so the question is will it become a sexually transmittable disease? And we don't know yet. So then the next question is, could it reach the bladder? And again, we don't know. We know that Epstein-Barr, the virus, can get to the bladder, just like we know that Lyme disease, Borrelia, can get to the bladder. But we don't have any information right now about COVID directly changing the bladder in any way. So I'm sorry to talk about it, but it is what it is. Low testosterone causes muscle weakness. Mine is low, but doctors hesitate to treat it. Muscle weakness isn't good for the pelvic floor. Thank you for explaining that. I will try to remember that. Becky says, I got a blood test. I did not have any testosterone, so my doc prescribed that along with estrogen. There you go. Melinda says, is there any natural herbs or holistic medicines that work for IC and overactive bladder? And the answer is yeah, absolutely. But again, it depends upon your subtype, right? So we have to focus on your subtype first, because if your IC is being driven by your muscles, there isn't a supplement that's going to help fix that. The way you fix muscles is with muscle work, with physical therapy, and or potentially with muscle relaxants. But the question is are there supplements that can help calm and soothe the bladder and or calm your nerves down? The answer is yes. And let me show them to you. So, and I want you to understand that I'm not here to try to sell you stuff. I'm not. The American Urology Association, in their AUA guidelines for IC, in step 1, so remember the AUA has 6 steps of treatment, and they're arranged with respect to the risk of adverse event. They don't want you to do step 6 until you've done step 1 or 2. And so it's all about you making good, thoughtful choices that pose the least risk first. So in step 1 of the AUA guidelines, especially if you've got bladder injury or Hunner's lesions, increasing your water intake, relaxing your muscles, dealing with stress, trying the IC diet, and yes, the AUA guideline says try over-the-counter nutraceuticals, supplements. Why? Because they have fewer side effects than the medications listed in step 2. So the medications listed in step 2 are going to be Elmeron, now linked to retinal disease, Elavil, amitriptyline, now linked, if you use it every day for 3 years or longer, it increases your risk of cognitive decline, dementia, and potentially even Alzheimer's. And so when you're in a situation where the vast majority of the medicines now that have been prescribed to IC patients for years are now linked to pretty serious side effects, that gives you all the more reason to take a step back and wait a second, let's look at step 1 first. So the AUA says consider nutraceuticals or supplements, same thing. So let's go over them really quick. So for the bladder wall, the key ingredient is chondroitin, and that was from a research study. Well, I mean, we've known this for years, but that was yet affirmed yet again in another research study released this year, that chondroitin helps to protect and improve the integrity of the urothelial cells. So these are the supplements in my order of preference. So Bladder Builder. This is a very robust formula. It not only does it have chondroitin and chondroitin and quercetin. So it has chondroitin for the bladder wall effect, quercetin for the antihistaminic effect. It's got a little collagen in it for the bladder wall. It's got some probiotics in it for the gut. It has got some amino acid in it, like L-arginine. But the most important ingredient in this, which I think makes it the best of the bunch, is it also has Peora, PEA, for pain relief, because last year we had yet another research study showing just how good PEA is for reducing chronic pain among a wide variety of conditions. So I put Bladder Builder as number 1. I put Bladder Rest as number 2. It's made by the same company, sourced entirely in the United States. And it's a very clean, crisp formula for people who flare with probiotics. So if you're somebody where you take a probiotic and it triggers you, Bladder Builder would not be the right one. It would probably be Bladder Rest or Cystoprotect. Cystoprotect's issues have all been solved. The new Cystoprotect capsules are red. Do not be alarmed by red capsules. They used to be brown. So Cystoprotect is back and alive and kicking. This was the top supplement for 15 years. Bladder wall effect from chondroitin and hyaluronate combined with quercetin in an olive kernel oil base. The biggest challenge with Cystoprotect is that it's heat intolerant, and it's very hard to ship in the summer. And so if you're somebody who loves Cystoprotect, you need to get it in the next 30 days to get yourself through the summer, all right? Then the next supplement would be Desert Harvest Aloe. The challenge with aloe is some people have gut issues with it, and so if you've taken aloe and it's upset your stomach, if it's given you diarrhea, you're not going to be able to do that, nor would you be able to do Cysto Renew, which is a combination. It's like Cysto Renew is kind of like these two together, you know, the aloe and the Cystoprotect together. What's cool about the Cysto Renew is he added lemon balm. And lemon balm, which is a mint with a lemony scent, is known for calming nerves down. The one that I still think is just the most exciting is Peora, PEA. There's no chondroitin in this one. This is just for pain relief. So this matches the formula that was used in the big IC research study in Europe last year. And in that study, a combination of PEA and resveratrol was found significantly effective at reducing pain and discomfort. And at 3 months, 87% of IC patients using PEA and resveratrol had a significant reduction in their pain. And at 6 months, every patient using it had a significant reduction in their pain, and 25% were pain-free. So if you have other supplements or treatments that you like, but you just would like a little bit of extra oomph with pain control, this might be interesting to try. What's exciting, too, about that original research study is there were no reported side effects. And I went before, when the study came out and we had the chance of potentially carrying something like this, I went in and looked at as many research studies as I could with sciatica, with burning mouth syndrome, with fibromyalgia, looking for side effects. And I was really pleasantly surprised to see that almost every research study using PEA reported no side effects. Only one found side effects, and that was a little stomach upset out of a dozen or more, 20 or more studies. So I think PEA is pretty exciting. And for anybody who's struggling with pudendal neuralgia or just with chronic pain, this would be something I think potentially worth adding based upon the research. Now, of course, there is a low-acid multivitamin called Bladder Smart. This replaces Multirite. We had Multirite for many years. That was something that I had suggested to FAR Laboratories, a low-acid multivitamin. But the same company that did Bladder Builder, I asked them if they would create us a formula that was easier. The Multirite capsule is very thick and big. I mean, pill. Almost impossible to swallow, whereas this is a clear vegetable capsule, much easier to swallow. I take this myself, never had a flare from it. And then I think the newest one, we've got two new ones, Prevent. They were asked by Dr. Ken Peters at Beaumont to create another option for Allura for people who get chronic UTI. And that's what this is, Prevent. And now patients have been using this for a couple of months in the Beaumont Clinic. And this is looking very, very good. So if you're one of those menopausal women, you keep getting recurring infections, especially recurring E. coli infection, this would be fascinating. Kelly says, when you say PEA helps pain, does that include bladder pressure? I have terrible pressure, but I'm not sure if that constitutes pain. Kelly, is that pressure accompanied by a downward sensation where you feel like something's falling out of you, or an upward sensation like somebody's trying to push something up inside of you vaginally or rectally or up your urethra? What symptom is that pressure coming from? I mean, do you have any of these other symptoms that we know can also cause pressure? So a downward sensation, an upward sensation, or feeling like you've got a golf ball or a bowling ball in your pelvis that won't come out. Do you have any of those symptoms? So the last supplement that these got, well, they have a prostate supplement that's coming out that is also being tested back at the Top ICU Research Center. And then the last one they're doing is called Aloe Path, and it's an aloe supplement, but aloe is pretty much the least important ingredient. It has a lot of other ingredients in it, and they're considering that one their most aggressive formula. But I don't have that bottle in hand, and I can't really talk to you about it. It's available. If it's not available now, it would be available very, very, very soon. I think they bottled it last week. So Melinda, there you go, my friend. Lots of options. And hey, man, you know what? Listen, when I was diagnosed in 1993, we had nothing. Cranberry juice. I drank cranberry juice for a year, a quart a day. I literally had a quart of cranberry juice on my desk at work. My goal was to drink a quart of cranberry juice a day because that was the only over-the-counter thing that we had back then. And oh, holy hell, I had no idea the damage that I was doing because of that daily acid wash just made the burns in my bladder, the wounds in my bladder that much worse. So at the end of that year, I was sobbing every night. The pain was so bad. And I really, I didn't know. It was another IC patient who finally said, Jill, don't you know that cranberry can really hurt you? Like, oh my God, I've been drinking a quarter cranberry just a day for a year because that's what we had. So at least now we've got lots of other options that are grounded by science. They're grounded by research. So where can you get these? We do have them in our store, the IC Network. Just go over to icnetwork.org and click on shop or store in the menu, and you can go over and look at them. Kelly says, I feel like somebody's pressing on my bladder 24/7, feeling like you have to pee all the time. So, Kelly, have you had a pelvic floor assessment? Our brain interprets pain in different ways. Now, I can tell you with my bladder wound, I never felt pressure. What I felt was pain, like crying, oh my God, there's a razor blade in my bladder, cutting my bladder. Actually, the way I used to describe it is witch's claws. It felt like somebody was rubbing sharp fingernails down my bladder wall after my bladder injury. I didn't have pressure until I had a hysterectomy, where it felt like there was this pulling downward, this very strong pulling downward. But our brains interpret symptoms differently. So it may be that, what for me is pain, your brain interprets as pressure. But I focus on pressure as being a little bit more mechanical also. Could you have a fibroid tumor pressing on your bladder? We know that fibroid, I want to say most, try to remember the research. I think it was like 60 to 70% of women with fibroid tumors had bladder symptoms because the tumor was pressing on their bladder. And when they removed the tumors, all the bladder symptoms went away. So sometimes it's helpful to pay attention to your intuition here. The language you choose is meaningful. You say it's like someone is pressing on your bladder. And so that really says, all right, well, we know things can press on your bladder, especially fibroid tumors, or really, 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 really tight muscles can squeeze all sorts of things down there, squeeze blood vessels, squeeze nerves. And so it's possible. Over on our website, in the diagnosis area is a whole page of confusable conditions. And these are the conditions, as you go through your diagnostic workup, you need to go look at that list and ask yourself, is this possible? And just start checking them off. You just got to start checking them off. Okay, so Kelly said, yes, but pelvic floor therapy never helped. So Kelly, when you went to the pelvic floor physical therapist the first time, what did they find? Were your muscles super tight? Was it on the left side, on the right side? Tell me what she found when at that first appointment. Just tell me. And then how many treatments did you have? So guys, for those of you on Facebook, she's over here on YouTube. If your muscles are tight and pelvic floor physical therapy did not work, that speaks, number one, to the skills of the provider. And it speaks, number two, to bony structures. Is there something else that is forcing your muscles to be tight over and over and over again? Like your feet, your legs, your hip. But Kelly, tell me, when you went to pelvic floor physical therapy the first time, what was her diagnosis? What did she find? Okay, while she's writing, I'm going to go back to Facebook here. Heather says, mine is a bad hip and arthritis in my back. My pelvic floor muscles are always tight. It does definitely affect everything. Exactly. Angie says, Jill, remember I had all that scar tissue on my left side for over 8 years because your colon was smashed. That had your colon smashed. Your right side overcompensated for years. So fear that's the only explanation of my tight muscles. I have the book and in the process of studying it. Good. And Angie, I'm sorry. I talk to so many patients every day that it's hard for me to remember details. And I deliberately do not take notes on the people that I talk with because I don't want to violate anybody's privacy. Brittany says, can bladder installation cause flares? I've had 3, and after the last one, I felt progressively worse. Your bladder is hypersensitive. My bladder is hypersensitive and painful. Yeah, Brittany, what kind of bladder installations were they doing? And I know you wrote that 30 minutes ago, so I hope I hope you're still here. Okay, so Kelly, she found tight muscles. Do you remember which muscles were tight? Were they on the left side, on the right side? Were they low? Were they high? You remember any details? Did she tell you if it was the levator muscles or the piriformis muscles or anything? Sean says, do I believe that IC is an autoimmune disease? Hun, remember, we have subtypes. We have very, very clear subtypes. So is Hunter's lesions an autoimmune disease? It doesn't meet the full criteria as an autoimmune disease. I see subtype 2 bladder wall driven. So is estrogen atrophy an autoimmune disease? No. Is a chronic infection an autoimmune disease? No. We have pelvic floor. Is that an autoimmune disease? No. We have central sensitization, pudendal neuralgia. Is that an autoimmune disease? No. Is there a very small subtype of IC patients that have autoimmune disease? Yeah, probably. Because, and why do I say that? Because if you look at some of the early research studies on related conditions, 3 to 4% of people had lupus and Sjogren's syndrome, other autoimmune disorders. So I do believe there's a small subset of patients who do have autoimmune disease that is affecting your bladder, but it's certainly not the vast majority. I think it's well under 5%. All right, Kelly says, they said you had pelvic floor dysfunction. You went on 3 separate occasions to 3 different therapists for 8 weeks. All right, so Kelly, what Dr. Weiss described is that during the physical therapy, he was able to relax the muscles and release the trigger points, but that within a week or 2, the tension was back as bad as it was. So when you went to physical therapy, did you feel better even just for a couple of hours or a day? Or did it have no difference? Did it make no difference at all? Angie, because 3 great physical therapists that included dry needling, it's really been the only thing that's helped, but the tightness always returns. Well, and that makes sense. Okay, so Kelly said the left side was the tightest. So Kelly, what Dr. Weiss says here is, okay, let's take a step back and study the left side. So for me, my tight side is my left side. I am right-handed. And that's what he said, that's what they see is if you're right-handed, the odds are it's going to be your left pelvic side that's going to be the tightest because of the way we walk. And I was a tennis player, so we stepped in with my left foot and as I swung with my right arm, right? The SI joint is the joint that connects your sacrum with your femur. And it is a joint that is meant to be stable and not move. If it starts to move, the muscles around it start to quiver, and they start to overcompensate, and they start to get tight, and then everything starts to hurt. And that's exactly what I have. I have left SI dysfunction now. And ultimately, in the end, my approach to therapy has to be not only trying to keep those muscles on the down low, but to try to stabilize the freaking joint. And and he talks about that in this book. And he brought up something about Piriformis Syndrome and SI dysfunction that I was not aware of, and that is that in many cases it's the ligament itself that is stretched out, and you can do something called prolotherapy to get the ligament tighter again, so that the muscles are not overcompensating. And that's what I was going to do before COVID hit myself, because as I'm sitting here right now, it just started vibrating. Okay, so Kelly says, while you were there, it felt a little better. So I don't think you have to, the last thing you should do, Kelly, is abandon your muscle work. Because as long as you have tight muscles, your blood flow is going to be poor in your pelvis. Your nerves are going to be compromised. Your pelvis cannot be healthy with tight muscles all the time. And so you shouldn't just abandon that. You've always got to work on those muscles. But now the question is, go back to the physical therapist and say, what is triggering this? Is it my feet? Is it my hip? Is it my knee? Do I have SI dysfunction? That's what you got to figure out next. And again, this book goes through the whole process with you. And the chapter on the feet is mind-blowing. I had no clue when I was like literally reading this book in January and I saw a chapter on the foot and I was like, what? Because I have been diagnosed with plantar fasciitis, Morton's toe, Morton's neuroma. I've had steroid shots on my feet, all sorts of things. And that would help. That also helps me understand why my left side's all screwed up. And so of anybody here at this meeting right now, Kelly, you are the one that needs to read this the most, because it will put it all in context for you. And your question always has to be, why do my muscles keep staying tight? Is there something else that's causing that? And I will bet you that you've got either SI dysfunction, a hip problem, a knee problem, or a foot problem. And that is the foundation for this. Now, I also do want to say something else, and I don't know if Sue is in here. We also have another case of somebody who was a very, very accomplished horseback rider, and she fell off onto her left side and has a terrible fall. She was very badly injured in the fall. And then at some point in period of time, she ended up with frequency urgency, diagnosed with IC, did all the IC treatments, nothing worked, went to pelvic floor physical therapy, Kelly, and pelvic floor physical therapy was really painful for her. I mean, she felt better, but it hurt. I mean, and normally pelvic floor physical therapy, it should just get better. The more you do it, it should get better. And in her case, no matter what they did, it always hurt. But now they figured out why, because she finally either had an MRI or CAT scan, and what they found was the giant knot of scar tissue on her left side, weaving in and amongst her muscles. And now that we know that is there, that explains why physical therapy was so painful for her all the time. But you indeed are an anatomical mystery to be solved. Hi, Ginger. Ginger just tuned in. And granted, you guys, I'm about 30 minutes behind your posts. Where can you get the shoes? Just go to hokaone.com or just Google Hoka, Hoka. Hey, you guys, if you can, could you please not mention doctors' names if you have something negative to share about them, okay? We don't want to be sued for libel or slander. Granted, I know I can't, but I don't want you to be sued either. This is a public forum. This is a video. It is better to not go there. And so I see a couple of comments about one doctor. I am deleting them from the transcript because I do not want those in the record here. So hold on a sec. Let me just do that real quick. How do you become a member? You just go on over to the IC Network website and click on the store, or there's actually, I think at the top of the page, how to become a member. Just click on that and it'll take you over to our store. I have, guys, we have a ton of websites. So I've got the IC, our main IC website is icnetwork.org, and that is rated #1 in the world by Harvard Medical School and the University of London. I'm very proud that my little doctoral dissertation proposal that I put together 27 years ago, 27 years later, is still the #1. We were literally one of the very first urology websites ever built. The National Institutes of Health was on, and I think Medscape was on, and WebMD and the IC Network. We were the only ones that did urology back then. Of course, now there's tons available, but we've been around a long time, and I curate all the information very, very carefully. I do not have anything for sale on the IC Network because I practice a divide and conquer strategy when it comes to security. So we have a support forum with 50,000 plus members. We have our website, and then I keep our memberships and our store on a separate website that the IC Network points to, that lives on a very, very secure, controlled environment. Let me just also say this to you. I'm going to be changing software in the store probably in the next month. We're going to go to Shopify. I was really struggling with my images in our store. I mean, the images just don't look very good. And it turns out the software compresses them, and I can't fix that. And there have been a couple of other issues with just me being able to provide, to change things. I couldn't change things easily. So we'll be switching over to Shopify in the next month. And also, I got to be just really blunt here. I'm going to be really blunt here. I live in Northern California. Fire season is starting. We've already had our first fire. Last year, we were evacuated for weeks. IC Network shut down. We were shut down. The big fire last year started 5 miles from our warehouse up in Hillsburg. They evacuated 250,000 people. We had 9 or 10 power outages from July through October to prevent fires. And when we have power, we don't have power, we cannot ship you product. And if we're evacuated, the Postal Service is shut down. They are not accepting product. We are now in a terrible drought. They have already told us it's going to be worse this year than any other year. And so if you guys rely on the supplements that we sell, I suggest you get it now. Because there's nothing worse than somebody calling and they run out of something, they forgot to order it, and either I don't have it, or right now first class mail's taking a month. I've got orders that we ship to Australia sitting in LA for a month because there are no planes flying to Australia right now for the Postal Service. So if you want to stock up to get through the summer and fall with COVID and with the damn fires, thousands of homes burned here, we are traumatized. I will give you volume discounts if you just want to get through it. If you call me personally, if you want 4 or more of anything, I'll give you 15% off, and because I want you to have what you need to get through this, because none of us know what the future is going to have. All I know is our first fire was 3 miles from my house last week, and it's starting, and it's dire again. And so I just want to make sure you've got your product. So if your supplement or whatever. So if these are important to you, please order accordingly, okay? I'm just being brutally honest. Listen, if we're evacuated again, we're going to Sacramento. I'm bringing 1 computer. I cannot bring product. With our natural approach nutrition products, we are deliberately keeping a supply in Utah, so that if that happens, they will be able to ship to you from Utah. So I'm doing the best I can to create options, but we can't do that for a lot of other stuff. So please, 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 if you can, stock up to get through this, because this is crazy. Becky says, Mary says, I'm a mail carrier and I'm finally used to wearing a mask. I've ordered many handmade ones. It's my new fashion accessory. I made masks for 5 weeks in my living room. I finally took everything down last week because I got sick of looking at it, but now I gotta set it back up again. Vicky says, where did I read about the COVID mutation? In one of the science journals. Yeah, and it has definitely mutated at least once. So there's the original COVID, and then a second more infectious COVID. You just Google COVID mutation. Anita says, I've been taking Cymbalta for osteoarthritis and it's helped my IC. Excellent. Glad to hear it. Anita, please know that Cymbalta and that class of medications can be very difficult to get off of. It's called Cymbalta discontinuation syndrome. So if you ever get to the point where you want to get off of Cymbalta, you're going to have to really plan that carefully with your doctors. Jill, do you think deep muscle massage with heat and using a TENS unit would be helpful? Not referring to internal muscles, but to externally to release muscles? Yeah. Anything that will help release those muscles would be great. I know that at my last physical therapist, I was going to a professional athlete physical therapist. He moved, unfortunately, to Colorado, was just starting to do some deep heat, and it was really working. And I'm really sorry that he's gone. Sherry says, considering the virus, some people don't realize that people live in apartments and aren't able to go outside to get sunshine. There are too many people stacked on each other to risk going outside. Plus, I don't have a yard. I know, hun, it's just a crazy time, but hey, man, listen, you guys are freaking strong. You can get through anything. If you can get through an IC diagnosis, you can get through COVID. You know, I mean, listen, we have been dealing with this for years. You have never been more prepared to deal with whatever happens to you than you are at this very moment. You can handle being, I mean, the irony here is when you've got IC anyway, especially if it's active, you stay close to your bathroom. So staying home isn't that much. It shouldn't be as disturbing, because we tend to be pretty used to it. We're pretty good on our own. And there will be a time when we will be able to go out and do more stuff again. But right now, y'all got to be pretty careful, especially if you're in Georgia or South Dakota or anywhere where you got those meat packing plants that are infected. Angie says uses a Theracane. Yeah, I have one somewhere. I got to find it. Melinda says, thank you for the wonderful information. I'm allergic to Elmeron, so the urologist was putting me on anything else for pain. Tried all the overactive bladder meds. Nothing worked. Diagnosed with IC about 10 years ago. Melinda, I'm shocked that they didn't bring up the supplements with you, because the supplements, or even heparin installations, would do the same thing. Rhonda says, for PEA for pain, I need to order this. It's worth it. Hun, it's absolutely worth a try. It's worth a shot. Rhonda says, what did you say, Jill? What did you say, Jill, is for the women with menopause because I'm ordering now the PEA? What did the... well, remember, if you're menopausal, you want something that has chondroitin in it that will provide a little bit of an extra coating to your bladder too. And there's no way I can tell you what's going to work for you. It's trial and error. And at least you've got a couple of different things to try. I really wish that we had samples, but none of the companies have samples at this point in time. The only samples that I'm aware of are for an aloe gel that you put on your cream. I mean on your skin. Ginger said, I had radiation treatment for uterine cancer that ruined my bladder with apparent scattering of strong radiation rays. Radiation ruined the mucosal lining, and I have red spots all over the lining of my bladder. The only medication that helps my chronic pain is time-release opiate pain pills. I've tried many other meds and procedures. None of that helped. I've even had 30 hyperbaric oxygen therapy treatments. After my last treatment, I had pain relief for a few weeks. When it came back just as bad. Ginger, number one, giant hugs to you. And yes, you have what we call radiation cystitis. I mean, giant hugs for you, hon. Oh, come on. Is that a heart? Come on. That's a heart. I think it would be really interesting if you tried the Piora too, because the Piora would have the potential of reducing some of that pain. Or the Bladder Builder, where you would have the coating effect combined with the pain fighting effect. I've worked with some radiation patients, not a lot. If you're wickedly diet sensitive because your bladder wall is severely wounded, then you definitely want a coating effect. It would also be very interesting, hon. I mean, I think it'd be really interesting to talk to your doctor and see. I mean, I'd be curious to see if like a rescue installation makes some of that pain go away. I mean, you could potentially do a daily installation of heparin lidocaine as an alternative to using maybe some of the opiates. I don't know. I mean, I don't know if that's possible or not. It would be really interesting. Rhonda says, I'm on the IC network. I only see Bladder Builder and Bladder Breast. Which one is the PEA? Well, the Bladder Builder is the one that has the PEA. But if you go to our store, make sure you click reload because they're all on the front page now because I just redesigned it. Yeah, I just redesigned it. So Bladder Builder, Bladder Rest, Piora, Prevent. Yeah, they're all there right on the front page. Heather, I really enjoyed listening today. Thanks for all the information. Happy to help. Sometimes it takes me a while to get warmed up. Rhonda says, I cannot believe I have problems with my feet. Seeing a rheumatologist, I thought it was lupus involving connective tissue. I'm now thinking it has to do with pelvic tightness after hearing you. Absolutely. Yeah, we're checking out and you love the hocus. Awesome. All right, guys. Well, listen, we've been going for almost 3 hours here. I think it's time for a giveaway, and it's Mother's Day. And some of you have stuck around. And so why don't we do a really, really nice giveaway? How about, tell you what, I'll give the winners a choice. I will either send you this book, Breaking Through Chronic Pelvic Pain, of which I have 3 copies left. So, or I will send you a bottle of Cysto Protect because they gave me extras. Okay, or so you can have a book, you can have a Cysto Protect, or you can have a mug. Look at this beautiful mug from our IC Awareness Month last year. Or a mug that says I See Strong. All right. So let us do, okay. Oh, I could be a real bear and give you a really hard question. You know what? I'm going to try the hard question first. but I will abandon it if we don't have an answer for that in a minute, and we'll go somewhere else. So about an hour ago, an IC patient came into the room who had a rare bony problem, and it was not a SI joint. It was with another bone down there that's supposed to be stable, but was loose and moving. And it's blank symphysis disorder. What was the name of the bone that was moving? The two bones that were moving that were giving her tremendous pubic pain. Does anybody know the name of the bone? It's a hard question, although I just totally gave it away. Heather says, I like to order the book. How do I do that? Hun, just go over to our website, icnetwork.org, click on the store. It's right on the front page of the store. And hey, I'll send you a free one if you know the name of, there are two different bones, joints in your pelvis that are supposed to be firm. If they move, they cause pain. One is your SI joint. Another one is with another bone right in the front and low. Does anybody remember the name of that bone? Nobody? You guys, I totally said it. All right, it's the pubic bone. Okay, so we're not doing that one anymore. I knew that was going to be hard. Okay. What is the name of the ingredient in a supplement that has been proven in research studies to restore integrity to the bladder wall? What is the name of that ingredient? Anybody? It's not glucosamine. It is... I'll take one winner on Facebook, one winner on YouTube. I've said it several times in the meeting today. When you're looking at supplements and you've got a bladder wall deficiency, what is the most important ingredient to have in that supplement? Not magnesium. Good guess. Anybody? Anybody? Oh, you guys, I feel like I'm failing as a support group leader. There it is. Allison. Allison Acton was the first to get it on Facebook. Mary Lasher, you are correct. Brittany, you are correct. Yes, 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 yes. Okay, maybe I didn't fail today. All right, so Allison Acton, you are the winner from Facebook. And Mary Kay, hold on. If nobody guesses it on YouTube, it's going to go to you too. So Allison, you get to choose if you want a book, if you want a bottle of Cysto Protect, or if you want a one of the gorgeous, gorgeous mugs from last year. I absolutely love this. So beautiful. So if you can email me, icnetwork@mac.com, and let me know which one you would like, I would send that to you. All right, YouTube, anybody? Sherry, you're close. You just miss. Okay, okay. All right, Sherry, I'll give it to you because I think you're you were in the right, you were trying. It's chondroitin. Chondroitin. There you go. I'll say. All right. So Sherry Diggs, Allison Acton, please email me icnetwork@mac.com. That's M as in Mary, A as in Apple, C as in Charlie.com. What you would like as your prize, and I will send that to you tomorrow or the next day. All righty? Yeah, Angie said it starts with, I know, I was going to say that. It starts with a C. All right, guys, last call for questions. Last call for questions. We've been at it for 3 hours. What are you guys doing to fill your days? Anybody doing anything fun? Yeah, start any new crafts at home? Or watching new series on TV. Oh, I just watched Deadwater Fell, a murder mystery series with David Tennant. Oh my God, it is so good. Deadwater Fell, Fell. If you like mysteries, and David Tennant is so good anyway, you'll never guess until the bitter end who the bad guy was. So good. All right. Okay, well, listen, I'm going to call it then. 4 o'clock, I'm going to go hang out with my mom because it's Mother's Day, see if I can do anything for her. So I'm going to put this to an end. Please know that I'm hoping to test Twitch this week so that we can switch all this over to Twitch TV so that I can actually do screen shares and show you more and do slideshows and stuff like that. I've been trying to do that for a year. We'll get there eventually. All right, my friends, I'll see you well. Have a good one. If you need to get a hold of me, email me, icnetwork.com. You can go to our website. We have an 800 phone number at the top of the page, also at the top of our Facebook page. Please feel free to give me a phone call or to give us a phone call. And as always, if there's anything that we can do for you, don't hesitate to ask. Here's your homework. 15 minutes a day, do something for your spirit. Especially right now, anything that will be calming and soothing to you is absolutely what the doctor ordered. I need you to do 15 minutes a day, something for your bladder, your pelvic floor. I need you to do 15 minutes a day, something for your noggin. Let's build your knowledge level up. You came here today, so you don't have to do anything else today, but tomorrow, come on over to our website and start reading. And last but not least, 15 minutes a day on something funny. TikTok is the way to go. All right, my friends. I will see you later. Be well. All righty, YouTube. I will see you all later.